Hello, my name is Ted Mitchell. Welcome to your 2020 Prescription Benefit Explanation. This presentation is intended for members utilizing prescription benefits offered by the Michigan Public School Employees Retirement System as administered by OptumRx. This recording will focus on the following areas of interest: your 2020 benefit overview, maximizing the value of your plan, member website and mobile applications, new innovations, how to contact OptumRx. Let's discuss your out-of-pocket costs for 2020 by learning about the benefit basics. Your 2020 copay. For generics and preferred name brand medication, the member cost share is 20%. This coinsurance includes a $15 minimum copay and a $45 maximum copay per 30-day supply. The 90-day coinsurance, also 20%, carries a $37.50 copay minimum and a $112.50 copay maximum. For non-preferred drugs, the member cost share is 40%. This coinsurance carries a $15 per drug minimum for a 30-day supply and a $37.50 per drug minimum for a 90-day supply. Please note that a non-preferred drug does not have a maximum copay. A 90-day fill of a generic or preferred brand name drug is your best value. Let's take a moment to discuss copay minimums and maximums. Here's how it works until you reach the annual coinsurance maximum. If the cost of the drug is less than the per drug minimum, you will pay the full cost of the drug. If the drug cost is more than the per drug minimum, but 20% is less than the minimum, you pay the per drug minimum and your retirement system pays the rest. If the drug price is above the minimum, you will pay 20% of the drug cost up to the plan max copay. Please note, non-preferred drugs do not carry a copay maximum. Let's take a look at a 90-day copay example for a generic or preferred brand name drug. Reminder, the member cost share is 20%. The 90-day coinsurance includes a $37.50 minimum and a $112.50 maximum. Filling a drug at a pharmacy with a retail price of $1,000 will result in a $112.50 member cost share. This is a good value. Compared to a non-preferred brand with a $1,000 drug price, because there is no per drug maximum, 40% will be charged to the member, resulting in a $400 copay. If you need assistance locating a preferred drug, please visit our website or call the number on the back of your card for assistance. Let's now discuss the annual coinsurance maximum. The annual coinsurance maximum protects you financially by limiting the amount of money you pay for medications. The annual coinsurance maximum is $1,750 per calendar year and will reset on January 1st, 2020. When you use generic and preferred brand name drugs, the full amount that you pay is applied towards the annual coinsurance maximum. When you reach the annual $1,750 coinsurance maximum, you will pay $0 for generic and preferred brand drugs for the remainder of the calendar year. After your annual coinsurance maximum is met, members using a non-preferred product will still be required to pay a copay. The copay will be reduced by 20% up to the plan max. How to maximize the value of your plan. There are three major factors that affect what you pay for your prescriptions. These factors include the formulary placement, the quantity you fill, and the pharmacy that you fill at. How the formulary placement affects your out-of-pocket expenses. A formulary is a list of drugs covered by your plan. Medications on the formulary are selected for their therapeutic effectiveness, safety, and value. The formulary is continually updated based on the latest research and clinical evidence. How much you pay for your prescription is determined by its placement on the formulary. Tier 1 is comprised of generic drugs. Generics have been on the market longest, first as brand products, then, when their patent has expired, as generics. Since generics have been around for a long time, their safety and efficacy has been proven, and they are value priced to save you the most money. On average, generics will provide an 85% savings over their brand name counterpart. Ask your doctor, is there a generic that's right for me? Tier 2 preferred brand and preferred specialty brand drugs will cost you more than generics, but they're still a good value if a generic drug is not available to treat your condition. Stay preferred. Preferred medications are lower cost or more clinically effective than a non-preferred medication. If a generic medication is not available, choose a preferred brand. Tier 3 and 4 non-preferred brand and non-preferred specialty drugs are simply going to cost you more money. These drugs are covered because your plan wants to provide you freedom of choice. But consider the cost and talk with your doctor if you're taking a Tier 3 or 4 drug. Odds are that your doctor can prescribe a generic or preferred brand that will safely and effectively treat your condition and at the same time save you money. Another factor that affects your out-of-pocket expense is the quantity filled. When you have an acute condition, like a sinus infection, you will generally receive a 30-day supply of drugs. Something to keep in mind is that a 30-day supply may cost less at the pharmacy counter, but when treating an ongoing condition with maintenance medication, a 90-day supply is in most cases a better value over the long run. Just like a Sam's Club, Costco, or other warehouse store, members save more when they buy higher quantities. Maintenance drugs are those that are taken on a regular basis to treat chronic conditions such as high cholesterol, high blood pressure, or diabetes. 90-day supplies are recommended for when therapy plans are already defined and tested. If you are working with your doctor to determine what dosage and strength will work best for you, we recommend a 30-day supply during this learning period to avoid wastage. Once you and your health team have determined the dosing regimen that is best suited for you, 90-day fills are a cost-effective, convenient way to access your maintenance medications. The pharmacy you choose affects your out-of-pocket expense as well. Retail pharmacies set their own prices. You will find different prices from one store to another, sometimes even within the same chain. Because the benefit has a percentage-based member cost share, member out-of-pocket expenses will vary depending on where they choose to fill their prescriptions. Our Price and Save tool, available on OptumRx.com, which we will cover in a few moments, is a great way to find the lowest priced pharmacy option. Also, many retail pharmacies offer medication at lower prices using in-store programs that work outside of your insurance. These programs can offer savings to members. However, drugs filled using in-store programs are not run through your insurance. That means that any money spent will not apply towards your out-of-pocket maximum. There are two ways to quickly and easily find a retail pharmacy near you. You can use our pharmacy locator tool at OptumRx.com, or you can call the number on the back of your ID card and a member services representative would be glad to help you. Now that we've reviewed retail pharmacies, let's take a look at mail order services offered by OptumRx. Mail order offers MPSERS members many advantages when compared to walk-in or retail pharmacies. These advantages include affordability. Your plan offers savings when filling a 90-day fill. Convenience. No more wasted time and gas with trips to the pharmacy. Have your medication delivered discreetly and safely to a location of your choosing. Better adherence. Members utilizing prescription medication delivery are more likely to take their medication regimens as prescribed. Studies indicate mail order utilizers are less likely to have unintended breaks in therapy, increasing overall health outcomes. And finally, free standard shipping. Your medications will be safely delivered to your door free of charge within 7 to 10 days from your order. Express shipping is available at additional cost. For medications with temperature considerations, OptumRx uses industry-leading packaging techniques to keep your medication safe from the elements. For members who are currently using our mail order services and access our website, you'll notice that you can now track your shipments right from our website or mobile application. Let's take a moment to discuss specialty medications. Specialty medications are high-cost oral or injectable medications used to treat rare and complex conditions. Because of the high cost, high complexity, and more sensitive shipping requirements, specialty medications are typically stocked and delivered by a specialty pharmacy. If you currently take a specialty medication, or if you should ever need to take one, OptumRx's specialty pharmacy, Briova Rx, does more than just fill your prescription. Briova Rx is more than a specialty pharmacy. We are an educational resource for our patients, a 24/7 support system, a trusted advisor to every member needing our support. Briova Rx has a staff of clinical experts who personally guide patients through their prescribed treatments to ensure safe, effective, and timely administration. Offering thorough education on all medications we offer, including injection training, proactive refill reminders, fast, free home delivery, all combined to make it easy for patients to adhere to their treatments without disruption or delay. In addition to personalized approaches, Briova Rx also offers exclusive savings to MPSERS members. Medicare members will receive lower costs exclusively through Briova Rx, while non-Medicare members must use Briova Rx to receive coverage for specialty medications. You can get answers to your questions with just a few clicks using OptumRx online resources. Find forms, plan details, and answers to your questions using our website or our mobile application. Visit our updated website at optumrx.com. On the OptumRx.com website, you can view and print your medication history, learn more about your medication, and keep track of your health history. You can order medications from OptumRx Home Delivery, download and print important forms and documents, including your membership card, review the formulary, and compare drug costs before you fill a prescription using our online drug pricing tool. All of the functionality we discussed on the website is also available on our mobile application, which is available for Android and iPhone. Please go to your App Store and search for OptumRx. OptumRx is proud to share recent innovations to make life easier. We now offer an expiring prior authorization program aimed at faster communication of required prior authorizations. Doctors will be contacted in advance to extend any current authorization. This is aimed to help avoid delays in getting your needed medication. OptumRx now offers much of your plan information electronically. including your benefit and plan summary, your claim summary, otherwise known as explanation of benefits, any billing and payments, your pharmacy care information, and tax documents. Where we used to deliver these via the mail, you will now have the option to sign up to receive them electronically. If you need help, OptumRx is here for you. While we would recommend the website or the mobile app mentioned earlier in this presentation, it is important to us that you know that we have member service agents available for you 24 hours a day, 365 days a year. Medicare members can reach us at 855-577-6517. Non-Medicare members can reach us at 866-288-5209. And all members can reach us at optumrx.com. Thank you.